So hello everyone. Uh, Let us start with the oral pathology test 2. Moving with the first question. The bite mark analysis involves a comparison of bite marks with the, you can see this figure, it's the bite mark of the individuals that is represented here on the cast. So the bite marks analysis involves the comparison of the bite marks with number one, the dental records. So this is the most relevant and most common used method in the bite mark analysis. So the most common method is the dental records. So that is the answer. The dental records, including the dental impressions, x-rays and treatment record, it can provide the detailed information about the person dental characteristics. Second option is the fingerprints. The fingerprints, the bite mark analysis, it is a distinct field from the fingerprint analysis. The fingerprint analysis involves the study of the unique pattern and ridges on the skin surfaces, particularly on the fingers and the palm. So it is used for the identification purposes, but it is not directly related to the bite mark analysis. The third comes the DNA evidence. So DNA analysis involves the examination of the genetic material from the biological samples like blood, saliva or hair to identify the individuals. The last option is the hair samples. So yes, the hair samples could be collected. So the bite mark analysis involves the comparison of bite marks with the dental records. So this one is the mnemonic. Remember BITE. Bite mark identification, impression, teeth characteristics, and evidence collection. That is for the bite mark. Moving to the next question, the bite mark analysis, it can be used to determine all of the following except. It can be used to determine all of the following except the dental history of the biter. The gender. The first option is the gender of biter. In some cases, the bite mark analysis, it may provide clue about the gender of the biter, such as the size and the shape of the dental arches or the spacing of the teeth can be determined by this terminology. Second is the approximate age of the biter. So one can identify by the development and the wear pattern of their teeth, their eruption pattern. One can identify the precise age of the biter. Third is the dental history of biter. So dental history cannot be identified. The dental history of the biter cannot be identified. The identity of the biter, yes, it can be identified through getting all the following methods. The third is the next question is a 35 years old pregnant woman present with peripheral neuropathy, glossitis, that is the inflamed tongue, and agular cheilitis, that is there is inflammation present at the corner of mouth. She will report a restricted diet due to the ethical belief avoiding all animal products. Laboratory tests show megaloblastic anemia with hypersegmented neutrophils. So that is the key option. So the clinical presentation of peripheral neuropathy, glossitis, angular cheilitis, and megaloblastic anemia with hypersegmented neutrophils in a pregnant woman with a restricted diet lacking the animal products, it is a highly suggestive of vitamin B12 deficiency. So remember, B12 deficiency, it is found in the animal-based food. And strict vegetarian diets. So B12, we know all that it is essential for the normal functioning of the nervous system, RBC production, and DNA synthesis. So its deficiency can result in various neurological symptoms megaloblastic anemia, and symptoms like glossitis and angular cheilitis. Whereas the other options like the vitamin B612 deficiency, it can also lead to peripheral neuropathy, but the characteristic finding like the megaloblastic anemia, hypersegmented neutrophils, it points toward the B12 deficiency in this case. Third is the vitamin C deficiency, that is scurvy. Here the patient will present with the bleeding gums, easy bruising, and poor wound healing. Whereas in a vitamin E deficiency, that is the tocopherol deficiency, it can cause neurological symptoms, but it is less likely to be as mentioned in the clinical history and presentation. Moving to the another question. The characteristic triad that shows iron deficiency, cholynokia, or spoon-shaped nails, or dysphagia, that is difficult in swallowing, that is the function of the Plummer-Vinson syndrome. So the Plummer-Vinson syndrome, it is a syndrome that is often characterized by a triad iron deficiency, anemia, esophageal webs, cheilitis, glossitis. These are the features of a Plummer-Vinson syndrome. It is often associated with iron deficiency anemia that can lead to various symptoms like spoon-shaped nails and difficult swallowing. Other options like Eagle syndrome, the Eagle syndrome where there is elongation of the styloid process that would cause a pain in the throat region. So either there will be an elongation of styloid process or there can be calcification of styloid ligament. The other option C is the Fanconi syndrome. What is Fanconi syndrome? It is a genetic disorder that affects the renal tubules in the kidney that leads to impaired resorption of certain substances like glucose, amino acid, and electrolytes. So that is also not option. Sturge-Weber syndrome, it is a congenital disorder characterized by facial birthmarks that are the port wine stings. Again, that's not the correct answer, so your answer will be Plummer-Vinson syndrome. Moving to the next question. A male reported with a slow-growing, white-colored, small, rough surface pedunculated enlargement seen on the right buccal mucosa. So this is the enlargement you can see. I have provided with the various images. However, these images are not given in your exam or in questions, so you can just cross-check them. Moving to the question, on further questioning, he confirmed a similar lesion in the genital organs. So your diagnosis will be the condition here described is slow-growing, white-colored, small, rough, pedunculated enlargement seen on the buccal mucosa that characterize a squamous papilloma. Other conditions like Verruca vulgaris, pyogenic granuloma, condyloma acuminatum described the different conditions. So answer here will be squamous papilloma. Next question. A teenager family reports to dental clinic with complaint of multiple shallow ulcers in labial mucosa and alveolar mucosa with no similar signs, cutaneous lesions. So incisional biopsy will give a picture of non-specific inflammatory lesions. The provisional diagnosis, it is the minor recurrent aphthous ulcers. So these are more frequent ulcers that could be seen, multiple shallow ulcers, that confirms the diagnosis of minor recurrent aphthous ulcers. Moving to the next question, Patterson-Kelly syndrome. Patterson-Kelly syndrome is also known as Plummer-Vinson syndrome. So there will be dysphagia, difficulty in swallowing, angular cheilitis, and candidiasis. So this one is the triad, dysphagia, iron deficiency, esophageal web. We discussed just few minutes back. Moving to the another question. A 58 years old male presents with a hemorrhagic crusting of his lips following a course of antibiotic therapy. So he does not have any systemic manifestation. So you can clearly see these are the hemorrhagic crusting that would appear on the lips. So that a characteristic feature of edema multiforme. So that is a skin condition that is characterized by sudden onset of target lesions. Target lesions we have discovered very well in the OP test 1 video lecture. Just go through that. You will get to know what is this target lesions. So you can see the hemorrhagic crusting of lips that can occur in the lips in the erythema multiforme. Various factors. It may be triggered by the various factors like the antibiotic. So antibiotic could trigger it. Just remember that. Other options like anaphylaxis, Behçet syndrome, lichen planus, they have a different clinical presentation. They are less likely to cause hemorrhagic crusting of the lips following the antibiotic therapy. So your answer would be A. Moving to the next question. A 65-year-old male presents to you for the dental treatment for rapidly growing ulcerated and indurated lesions. He is a chronic chain smoker, 20 cigarettes per day. On examination, you will see a hard, fixed, non-tender submandibular lymph node gland. It is palpable. So your investigation would be, since it is a rapid growing, ulcerated, indurated, and the patient is a chronic chain smoker with a hard, fixed, non-tender submandibular lymph node, so that will raise a significant concern for the oral squamous cell carcinoma. So remember, the oral squamous cell carcinoma is a malignant tumor. It is a malignant tumor associated with the tobacco use, especially smoking. So presence of ulcerated, indurated, with the history of smoking, it is a red flag. It is a red flag for the potential oral cancer. And the possibility of submandibular lymph node suggests the regional lymph node involvement that is common in advanced oral cancer. Moving to the next question. A patient reported with asymptomatic white patch on the buccal mucosa that cannot be rubbed off. So this white patch, you can clearly see it is seen in the leukoplakia. The most probably diagnosis for the heavy cigarette smokers with asymptomatic white patch on the buccal mucosa that cannot be rubbed off and has been present for last 3 months, it's leukoplakia. So leukoplakia, it is a white patch or plaque of the oral mucosa, including present most commonly in the buccal mucosa. So leukoplakia, it is strongly associated with tobacco use, and it is a precursor to the oral squamous cell carcinoma that was discussed just later on. So other conditions like candidiasis or white sponge nevus may also be present with a white patch, but the history of heavy cigarette smoking and chronicity of the lesion make leukoplakia the most likely diagnosis. The erythroplakia, that is characterized by red patch, and it is associated with a higher risk of malignancy. Moving to the next question. A patient on antibiotic therapy for the scarlet fever develops white plaque on his oral mucosa, which when scraped leave a painful bleeding surface. The most common diagnosis, it is the presence of white plaques on the oral mucosa when scraped with a tongue blade. It is characteristic of oral candidiasis or the thrush, that is a fungal infection that is caused by which fungal microorganism. It is Candida species, mainly the Candida albicans. The next question. The examination of child showed diffuse enlargement of left side of tongue with small elevated grayish pink nodules, which are fluid filled with the rest of oral cavity being normal. So most common diagnosis it will be lymphangioma. So this image based question was asked in one of the exam SRship AIMS SRship questions, and this figure was asked and identified it is lymphangioma. So the most common diagnosis for child with enlargement of the left side of tongue with small elevated grayish pink nodules, some of which are fluid filled, is the lymphangioma. Lymphangioma, they are the benign tumors of lymphatic vessels. They can occur in various parts of body, including the tongue. So in oral cavity, they will present as cystic or nodular lesions with grayish pinkish appearance. So these nodules can contain a fluid species. Moving to the next question, the sun ray spicules, they are radiographic characteristic of. The answer is osteosarcoma. So the sun ray spicules, they are radiographic characteristic associated with osteosarcoma. So this appearance, it occurs when the lesion grows rapidly and periosteum is unable to deposit a new bone in an organized manner. So the sharpest fiber that attach the periosteum to the bone, they stretch out and forms a spicules that radiates outwards from the lesion, creating a sunburst or sun ray pattern on the X-ray image. A 15-year-old man complains of tingling sensation in the lower lip. Intraoral examination discloses a painless hard swelling in the mandibular premolar region. The patient first noticed this swelling 3 weeks. The radiographic indicates loss of cortex and diffuse radiating pattern of trabeculae. So most common it is osteosarcoma. Moving to the next question, TB can be easily differentiated from squamous cell carcinoma by, yes, the biopsy can confirm the diagnosis. So a biopsy involves taking a tissue sample from the affected area and examining it under microscope. So in the case of tuberculosis, specific staining techniques and culture may be necessary to confirm the presence of Mycobacterium tuberculi, whereas the squamous cell carcinoma will show cancerous change in the tissue. So when the nevus cell, they are limited to the basal cell layer of epithelium, it is known as so when the nevus cell, they are limited to basal cell layer of epithelium, it is a junctional epithelium. So junctional epithelium are a type of nevi that consists of nevus cell within basal layer of the basal layer of the epidermis. The compound nevus, so they are present in both the epidermis as well as the dermis. The intradermal nevus, they are entirely within the dermis. Which type of Hodgkin lymphoma is associated with the best prognosis? So lymphocyte predominant, it is associated with the best prognosis. And which subtype it is associated with worse prognosis? It's the lymphocytic depletion. Remember that. Which is most common? It is the nodular sclerosis, that is the most common variety and has a favorable prognosis. Moving to the next question, a 60-year male reported with chronic cough and enlarged bilateral parotid glands. FNAC from parotid glands reveal no granuloma. So your answer would be sarcoidosis. So the most sarcoidosis, it is a inflammatory disorder that can affect the various organs like the lungs, salivary glands, parotid glands. So enlarged bilateral parotid glands, they are the feature of the sarcoidosis. TB can also cause granulomatous inflammations. The sarcoidosis, it is more likely in the absence of the chisating granuloma, and it presents with the parotid gland enlargement and chronic cough. So the option C, D, they are not associated with parotid gland enlargement. So that is why your answer is sarcoidosis. Highest incidence toward malignancy, it is the erythroplakia. So remember for your exam, erythroplakia has the highest incidence toward the malignancy. Many a times asked in your entrance exam. A lady complains her 9-year-old daughter is suffering from oral ulceration, fever, and shedding of skin from palms and soles. She is giving history of premature exfoliation of teeth and increased sweating. So all these features are of acrodynia. So acrodynia, it is due to the chronic. Remember, acrodynia is due to the mercury poisoning. So it is also known as pink disease. So what is characterized by a range of symptoms that includes fever, shedding of skin from the palms and sole, exfoliation of teeth, increasing sweating and other manifestation. So here it is given a history of patient using a new teething gel. So it is possible that gel that contains mercury or mercury-related component that can develop acrodynia. The next question, an adolescent girl, orangish yellow pigmentation, it is seen on the permanent teeth. So that is, there is a history of chronic disease for which she was hospitalized. The reason, it could be pellagra. So remember the orange yellow pigment. The orange yellow pigment, it is caused due to the pellagra. It is caused due to the deficiency of vitamin B3. So the orange yellow pigmentation on the permanent teeth with history of chronic disease, it is mostly due to the pellagra. Moving to the next question, a 50 years old patient complains of burning sensation on eating spicy food and complaints of blister formation. On digital palpitation, the mucosa slough off. Histopath, evidence of acantholysis and suprabasilar split. So all this we have discussed in the, it is example of pemphigus vulgaris. All these are feature of pemphigus vulgaris. We have discussed that later on. A man who consumed meat sandwich at the party and complains of nausea, vomiting and abdominal pain after 2 hours. What could be the cause? The most common cause is staphylococcal toxin. Cephalotoxin, it is the most common cause of the food poisoning. So the symptoms of nausea, vomiting, abdominal pain within a short time frame, within 2 hours after consumption of meat, it is suggestive of staphylococcus infection. So it occurs when the food is handled and stored improperly. So that will allow the Staphylococcus aureus bacteria to produce toxin, and that can cause gastric symptoms. Moving to the next question. Hereditary angioedema, it is due to the deficiency of enzyme C1 inhibitor, that is a regulatory protein of the complement system. So this deficiency that leads to uncontrolled activation of the complement system. So there will be a recurrent episode of swelling and edema. In the skin and the mucous membrane. Moving to the next question. In sickle cell anemia, certain radiographic changes in the bone of the skull appears. So these appearance, the hair on and appearance. So in sickle anemia, certain radiographic changes in the bone of skull it can occur that include the hair on and effect. So that results from the increased erythropoiesis in the bone marrow. That will lead to the increased erythropoiesis in the bone marrow will lead to widening of diploid spaces and thinning of the inner and outer table of the skull. That will create a hair on end appearance. Moving to the next, the sickle cell anemia. The sickle cell anemia, it is a point mutation in the beta globin gene that leads to missense mutation. Specifically, it involves the substitution of adenine for the thymine in the 6th codon of the beta that results in abnormal hemoglobin. So the normal protein contains glutamine and it is replaced by valine that leads to point mutation. Among hepatitis, syphilis, glossitis, Plummer-Vinson syndrome, Mikulicz syndrome, squamous cell carcinoma is most likely to occur in both the syphilitic glossitis and Plummer-Vinson syndrome. They are associated with chronic irritation and inflammation of oral cavity that leads to increased risk of squamous cell carcinoma. So your answer is syphilitic glossitis and Plummer-Vinson syndrome. Patient with history of betel quid chewing for the past 5 years with ulcerative lesion, incisional biopsy was performed and histological examination revealed the dysplastic stratified squamous epithelium. So peripheral palisading of the cells. The peripheral palisading of cells can be seen. Your diagnosis is squamous cell carcinoma. So these features are of squamous cell carcinoma. Which of following is not cause of macroglossia? It's leukemia. So remember that leukemia is not a cause of macroglossia. Macroglossia is the enlargement of the tongue. Hemangioma, lymphangioma, they are the vascular malformation that can lead to tongue enlargement. Down syndrome, it is a genetic disorder that may include macroglossia as one of its features. The surface of oral squamous cell carcinoma will usually feel to touch. It will be a rough to touch. So this roughness is due to irregular and ulcerated or nodular nature of the tumor. Cramping of tongue after drinking cold water is paramyotonia. It is a disorder that is associated with muscle stiffness and prolonged muscle contraction. So the cold temperature, it can increase the myotonic symptoms in the individual with this condition. The weakness of muscles, facial muscle, that there is inability to open and close eye and mouth. It is seen in mild restrictive muscular dystrophy. So weakness of facial muscle that leads to inability to open and close the eye. It is seen in option C. Petrified man. Petrified man, it is condition that is seen in myostatic ossificans, that is formation of, in myostatic ossificans you will see there will be formation of heterotropic bone as a result of trauma or injury to the muscle. So whenever there is injury to the muscle, there will be formation of heterotropic bone within the muscle. So that can lead to muscle stiffness, pain, and limited range of motion. So that is why it is known as a petrified man. Gandy gamma bodies are seen in sickle cell anemia. So these are the small calcified nodules that can be seen in the spleen, and they are associated with chronic congestion. So these nodules are seen in individuals with the sickle cell anemia due to the congestion of the sickled RBC in the spleen. So spleen, it plays a significant role in filtering damage or the abnormal red blood cells. So these processes can lead to formation of these calcified nodules. Which one is a oral precancer? It's speckled leukoplakia. So speckled leukoplakia is oral precancerous lesion. It is also known as erythroleukoplakia or mixed leukoplakia. So moving to the next question, the notched incisors and the mulberry molars, they are most commonly seen in. Well, the notched incisors and the mulberry molars, they are the most commonly they are found in the congenital syphilis. So these are this figure represents the notched incisors. So they have a notching, and the mulberry molars. This one are the mulberry molars. So these features, they are seen in the congenital syphilis. That is a condition that is caused by transmission of syphilis from pregnant mother to her baby during the pregnancy. So the dental features, it includes the notched and the screw-driven shaped incisors. So the incisors, they will resemble screw-driven shaped and are notched, and the molars, they appears like mulberry. That is why they are known as mulberry molars or the screw-driven shaped or the notched incisors. Moving to the next question, a purulent lesion in the facial vestibule of an 8-year child is mostly due to. A purulent means a pus-filled lesion in the facial vestibule of 8-year-old child. It is most likely due to be the odontogenic fistula. So this one is the odontogenic fistula. A fistula means a tract that forms between the infected tooth and skin or the mucous membrane that allow the drainage of pus from an underlying dental infection to the surface. So other options like pyogenic granuloma, odontogenic tumor, they are less likely to cause purulent lesion in the facial vestibule. So your answer would be odontogenic fistula. Moving to next question, Sutton disease is a Well, Sutton is a recurrent aphthous major ulcers. So Sutton disease, it's also known as recurrent aphthous major ulcer. That is a condition that is characterized by presence of major aphthous ulcers. So these ulcers, they are large, deeper and more painful than the minor aphthous ulcers. A 7-year-old girl present with repeated episodes of bleeding into the joints. APTT is prolonged and PT is normal. The most likely deficiency diagnosis is the most likely diagnosis is factor 8 deficiency. So hemophilia, it is a hereditary bleeding disorder that is caused by the deficiency of factor 8. So with when a person with hemophilia A experience bleeding episodes, they have prolonged APTT, that is activated partial thromboplastin time. And PT prothrombin time, it is normal. The bleeding into joints, it is a common feature of factor 8 deficiency. Moving to the next question. Which of following is not a precancerous condition? So your answer is seborrheic keratosis. Moving to next question. Which of following is most likely to turn malignant? It's the junctional nevus. So in the intradermal nevus, the nevus cells, they are situated within the connective tissue and they are separated from the overlying epithelium by well-defined band of connective tissue. Whereas in the intradermal nevus, the nevus cells are not in direct contact with the surface epithelium. So your answer would be B. Junctional epithelium, it is most likely to turn into malignance as compared to intradermal nevi. So in the junctional epithelium, the nevus cells, they are in direct contact with the surface epithelium. So that is why they can turn into malignant melanoma. A 40-year-old patient presented with multiple extraoral sinuses, with yellow discharged and with history of intermittent emissions after antibiotic treatment. A disease started after extraction of second pendibular premolar. That is suggestive of actinomycosis. So the multiple extraoral fistula with the yellow discharge, it is a characteristic feature of actinomycosis. So actinomycosis, remember, it is a bacterial infection. It includes, the features include multiple extraoral drainage sinuses, a history of dental extraction, and yellowish discharge. So this condition is characterized by formation of abscess. So history of intermittent remission after the antibiotic treatment, it is suggestive of actinomycosis. Also the sulfur granules, the yellow discharge, sulfur granules. These are the most important characteristic feature of the actinomycosis. Next question. Harford syndrome, it is characteristic by triad of, so it is a triad of uveal tract infection. The term we donate is uveitis, parotid gland swelling or parotid gland enlargement, and the facial nerve palsy. So these are the triads. Name the lesion which is not a radiolucent lesion of the jaw. The answer is focal periapical osteopetrosis. So it is not a radiolucent lesion. Instead, it is a condition that is characterized by increased bone density. So that results in radiopathy. So in contrast, ameloblastoma, cherubism, and odontogenic cyst, they are all associated with a radiolucent lesion in the jaw. Bleeding time and prothrombin time, it is prolonged in answer is DIC. So due to the consumption of clotting factor, bleeding time and prothrombin time, they are prolonged. So here there is activation of coagulation cascade that leads to consumption of the clotting factor and platelets. So this consumption results in both the bleeding time and prothrombin time to be increased. So it is a condition that is characterized by abnormal clotting and excess bleeding. So making it a correct choice in the scenario. Which of following is most common fungal infection in immunocompetent patient? Candida. Yes, Candida, it is the most common fungal infection. Remember that, and it is very important for your most commonly they asked in entrance exam these type of questions. In brush biopsy, the brush it is typically rotated at the center of lesion. This brush is rotated 4 to 5 times to collect cellular material for the microscopic examination. So this technique, it is used for the diagnosis of various oral lesions, and it is used for obtaining samples from the different layer of the epithelium. So which of following is a feature of upper neuron motor lesion of facial nerve? In the upper motor lesion of facial nerve, such as in case of central facial palsy or supranuclear lesion, the upper part of face, including the forehead, it retains the ability to make voluntary movements and wrinkle. So answer would be retained ability to wrinkle foreheads. So these lesions typically affect the lower part of the face, leading to loss of the emotional movements and voluntary control over the lower facial muscles. In order to recognize tumor invasion, which of following is most reliable diagnostic modality? The most reliable, the study of the perineural spaces, it is most reliable diagnostic modality to recognize the tumor invasion along the nerves. So the perineural invasion, it is the most reliable diagnostic modality. These tumors can infiltrate the nerves and follow their paths without significantly disrupting the surrounding tissues. Statistically, what is the percentage of dysplastic changes to occur in case of leukoplakia? It is generally 12 to 25% when a biopsy is performed. So it is important to note that all cases of leukoplakia, not all the cases of leukoplakia, they progress to dysplasia or cancer. So regular monitoring is important for early detection and management of any potential malignant changes. Of which of the following the most common disorder causing the pain about the masticatory apparatus? It is the myofascial pain dysfunction syndrome. It is the most common TMJ disorder, and it may present with or without restricted mouth opening. So pain causes the jaw closing muscles to contract, so the pain itself may initiate the degree of mandibular restriction in case of MPDS. Hypopigmentation, gray streak of hair, degranulation, defect of neutrophils, neuropathy. It is seen in Chediak-Higashi syndrome. So hypopigmentation results from the pigment. It is a Chediak-Higashi syndrome. It is a rare autosomal recessive disorder that is characterized by features including hypopigmentation that results in gray streak of hairs, degranulation defect of neutrophils, leading to susceptibility to the bacterial infection and neuropathy. So it is also characterized by giant blue-gray granules in the cytoplasm. So which statement is true for toluidine blue? So toluidine blue, it can be directly applied to suspicious lesions, and it is used as a diagnostic in identifying the area that may require a biopsy. So answer is it can be directly applied to the suspicious lesions. So most common site for non-Hodgkin lymphoma outside the lymph node, it's the stomach. So non-Hodgkin lymphoma, it can indeed occur outside the lymph nodes, and one of the most common extranodal site is stomach. Vitamin B12 and folic acid supplement in megaloblastic anemia leads to improvement of anemia due to the vitamin B12 and folic supplementation, they are used to treat megaloblastic anemia by increasing the DNA synthesis in the bone marrow. So both vitamin B12 and folic acid, they are essential for production of nucleotides. So that are the building blocks for the DNA. So deficiency in these vitamins can lead to impaired DNA synthesis that results in characteristic feature of megaloblastic anemia like enlarged and immature RBC that they are known as megaloblasts. Computerized assisted analysis of cytobrush cytology helps to identify the abnormal. The computer assisted analysis of cytobrush, it helps to analyze the abnormal cell morphology, including the shape of keratinization. So this technique is important in detecting the cellular abnormalities that may indicate various oral conditions, including potential precancerous or cancerous changes. So all of following are the tumor marker except alpha HCG. So HCG, it is a placental hormone. It is alpha-fetoprotein, thyroglobin and beta-2 microglobin. They are commonly used tumor markers. Alpha HCG, it is a subunit of human chorionic gonadotropin, and it is not typically used as tumor marker. So because of its cross reactivity potential with other hormones like FSH, LH and TSH, so all of following a tumor marker except alpha SCG is the answer of choice. The most common location for occurrence of basal cell carcinoma, it is a face above a line from lobe of ear. The basal cell carcinoma, it is the most common type of skin cancer. It occurs on the sun exposed areas of body, with the face being the most common location. So it is frequently found in the line drawn from lobe of ear to the corner of the mouth. So it is invasive, slow growing nature, and it rarely metastasizes. So your answer would be line from the lobe of ear. The Reynolds phenomena with facial involvement along with deposition of anti-dsDNA antibody in kidney, skin, choroid plexus and joint, it is a feature of SLE. So SLE, it is an autoimmune disorder that can affect various organs and tissues. Reynolds phenomena that involves the abnormal blood vessel constriction in response to the cold. So Reynolds phenomena is blood vessel constriction in a response to cold. The presence of anti-dsDNA antibodies, it is a specific marker for SLE. Rhabdomyosarcoma, it is a tumor originating from the rhabdomyosarcoma, it is a malignant tumor. Remember, it is a malignant tumor that originates from the skeleton muscles. So it is a malignant tumor of the striated muscles. The primary defect in xeroderma pigmentosa is the formation of the adenine dimers. Xeroderma pigmentosa, it is a characteristic by defect in DNA repair mechanism. So there is formation of thymidine dimers. Due to exposure of under the UV light, UV radiations. So that causes skin cancers, and it is inability to repair the UV induced DNA damage properly. Cryptococcus, it is least likely to cause infection of Cryptococcus, it is least likely to cause infection in the kidney. It is primarily acquired by the inhalation of fungus into the lungs. It can spread into various organs like brain, skin and bone. And the renal involvement can occur in severe cases. It is less likely and less common involvement in other organs like the brain. So moving to the next question. The verrucous carcinoma is remember the verrucous carcinoma, it is a well differentiated variant of squamous cell carcinoma. It is characterized by slow growing, exotic and locally invasive nature. So the verrucous carcinoma, it has a lower malignant potential as compared to the squamous cell carcinoma. The next question. Which of following fungal infection exhibit pseudoepitheliomatous hyperplasia on the histological examination? The answer is blastomycosis. So blastomycosis, it is a fungal infection that exhibit pseudoepitheliomatous hyperplasia. So it is a reactive proliferation of the squamous epithelium So blastomycosis, it is a fungal infection that exhibits pseudoepitheliomatous hyperplasia on the histological examination. So this hyperplasia can be prominent when examining tissue affected by the infection. So which of following intraoral site can be affected by recurrent aphthous ulceration? The recurrent aphthous ulceration can affect various intraoral sites including the buccal mucosa, so these ulcers can also occur on tongue, lips, soft palate and other mucosal surfaces. Hutchinson triad includes all except. Remember, the Hutchinson triad include following features. It involves ears, eyes and teeth. So for the ears it causes eighth nerve deafness. So this one is correct. For eyes it causes interstitial keratosis. This one is also correct. And for teeth it is related to mulberry molars and notch incisors. So it does not involve seventh nerve deafness. That will be your correct answer. The presence of sulfur granules in the pus, it is characteristic sign of the characteristic of the sulfur granules found in actinomyces. They represents the colony of bacteria. So the sulfur granules, they represent the colony of bacteria. Actinomycosis, it is a bacterial infection primarily caused by Actinomycosis israeli, and it is characterized by sulfur granules that are composed of these bacteria along with the host tissue component. So these granules, they can be seen in clinical specimen, and these are the distinct feature of this condition. Moving to next question. Photosensitivity, rash, fever, autoimmune disorder and arthritis, they are included in spectrum of the correct answer is SLE. So SLE, the photosensitivity, rash, fever, autoimmune disorder and arthritis, they are part of clinical spectrum of the SLE. So what is SLE? It is a chronic autoimmune disease that is characterized by formation of autoantibodies against the various cellular components. So that leads to deposition of immune complex in various tissue. It primarily affects the women's in the childbearing age. Toluidine blue is used to differentiate. Answer would be malignant transformation of dysplastic tissue. Toluidine blue, it can be used to differentiate malignant transformation of dysplastic tissue. It is often used to stain tissues associated with malignant transformation in the dysplastic tissues. So this staining technique can identify potential cancerous changes in the tissues. Open bite in a bright and intelligent child of 8 years worsening progressively with no history of thumb sucking or tongue thrust, with the deficient molar bones and difficulty in hearing. It is suggestive of Trachen-Collins syndrome. Most reliable criteria for diagnosis of squamous cell carcinoma, its invasion. So most reliable histological criteria for diagnosis for squamous cell carcinoma is the invasion. The presence of invasion into the surrounding tissue, it is a hallmark of malignancy, and it distinguishes squamous cell carcinoma from the benign lesions. So invasion, it is a key histological feature in diagnosis of cancer. Lacunar cells, histological variant of Reed-Sternberg cells, they are present in which of following types of Hodgkin lymphoma? They are seen in nodular sclerosis type. So these are the Reed-Sternberg cells. So lacunar cells, these are the histological variants of Reed-Sternberg cells that are present in the nodular sclerosis Hodgkin lymphoma, that is characterized by a nodular pattern with broad bands of fibrosis that divide the lymph nodes into nodules. A 23-year-old female presenting with anemia jaundice for 2 years, peripheral smearing shows spherocytosis. So best treatment is the Coombs test. A positive Coombs test will indicate the presence of antibodies on the surface of RBC that can lead to hemolysis, that is destruction of RBCs. So this test helps to diagnose autoimmune hemolytic anemia that can present with symptoms like anemia, jaundice, and spherocytosis on the smear. HM45, it is a immunological marker for melanoma. So it is a specific antibody used in immunohistochemistry to identify the melanotic lesions. So it is important in diagnosis melanoma. In forensic laboratory, some samples are being examined under UV light. So doctor notices blue whitish color of the sample. So which is the most probable content of the sample? So DNA. So when a sample exhibits a bluish whitish color under UV light, the most probable content of sample is semen. The semen, it contains fluorescent compounds that emit a bluish white fluorescence. So when exposed to UV light, so this property is used in forensic analysis to detect the presence of semen in the sample. A child develops blisters on sunlight. Irregular dark spots on skins, they are also found. Which of following is likely to have defect? The defect lies in the nucleotide excision repair. So nucleotide excision repair, it is a DNA repair mechanism responsible for removing and repairing the UV-induced DNA damage, such as the thymine dimers caused by exposure to UV rays from the sun. The only variety of oral candidiasis which is consistently painful and has prediction for smokers is the acute erythematic candidiasis. So remember, the erythematous candidiasis is consistently painful. So answer is acute the metas candidiasis. So which of following is least likely to occur after simple excision? Answer is oral fibroma. The least likely to reoccur after simple excision is irritational fibroma. So they are the benign fibroma growth that results from chronic irritation or trauma to the oral mucosa. So they typically do not reoccur after simple surgical excision. Most common site for occurrence of leiomyoma in head and neck region, it is the posterior part of the tongue. So most site where osteosarcoma is most common, osteosarcoma, it is the most commonly found in the lower end of the femur. Remember that. So remember, osteosarcoma, it is a type of bone cancer that occurs in the long bones of arms and legs, and lower end of femur, it is the most common location for this carcinoma. The highest risk of leukoplakia converting into squamous cell carcinoma, it occurs in the highest risk of leukoplakia converting into the squamous cell carcinoma, it occurs in the floor of mouth. Leukoplakia, we know it is a white patch that can develop on oral mucosa, and it is a precancerous condition. The floor of mouth is one of the condition. It is one of the site where leukoplakia is at higher risk of malignant transformation. So giant cells of periodontium, they are best considered as non-neoplastic reactive lesions. So these lesions, they are not considered benign or malignant, but rather a reactive response to various stimuli or conditions within the periodontal tissue. Keratoacanthoma appears to be histological as epidermoid carcinoma because the histological appearance of keratoacanthoma, they can resemble epidermoid carcinoma. So it is a benign skin tumor that can mimic squamous cell carcinoma both the clinically and histologically due to presence of deep invasion margins. Which of following location listed is more common primary site for the squamous cell carcinoma? It is the floor of mouth. So which of following disease is associated with the tobacco use? All of the disease related frictional keratosis, leukodema, hairy tongue, they are related with the tobacco use. Tobacco use, whether through the smoking or smokeless form, it can lead to various health issues as mentioned here. Which of following is the most common odontogenic tumor? Well, it is odontoma. Odontoma is the most common odontogenic tumor. So the odontomas, they are more common encountered in the clinical practice than the ameloblastoma. One of the following lesion has extreme high rate of malignant transformation. It's the nodular leukoplakia. So here you will see nodules, raised areas of mucosal surface, and it is associated with particular high risk of progressing to squamous cell carcinoma. A malignant tumor that metastasizes to bone most often it's the Wilms tumor or neuroblastoma. It is the most common intra-abdominal solid tumor in children. The pre-malignant condition with highest probability of progression to malignancy is erythroplakia. Remember for your exam point of view. So erythroplakia, it is characterized by red velvy patches on the mucous membrane, and it has a high risk of being associated with squamous cell carcinoma. Ameloblastoma, it develops from the dental lamina. So that is the group of cells that are involved in tooth development. Least common type of ameloblastoma. The least common is the basal cell carcinoma. Basal cell ameloblastoma, sorry. The most common metastasis site for ameloblastoma is the lungs. Most aggressive form of ameloblastoma, it is the granulomatous form. Behcet syndrome, it is characterized by oral aphthous ulceration, genital lesions, and positive pathology with relapsing uveitis. Hereditary hemorrhagic telangiectasia, it is a feature of Osler-Weber-Rendu syndrome. So that is characterized by abnormal blood vessels that leads to telangiectasia. That is the blood vessels become small and dilated, and you will see AV malformation in various organs of the body. Monroe abscess, it is seen in psoriasis. They are intraepithelial microabscess. So which of following is the most common malignant tumor of the gingiva? It's the squamous cell carcinoma.